So our primary working diagnosis is ALL doc. Pero we are turned doc between AML and ALL. Na-roll out lang namin ng AML because we haven't seen the subcutaneous nodules. Pero based on Hanilson po, doc,
Pero
an
age ito yung patient.
3 to 4 po, doc. So, asya among primary working diagnosis because an ALL, an iya peak hania disease is 3 to 4 years old po.
So, it kung kasi, you cannot totally
Animal.
rule it out, not unless you do a bone marrow.
Yes, doc. That's what.
So, have you considered HSP?
Ano po, doc? Sorry, pardon.
HSP, ITP,
Oh, yes.
vasculitis.
Mm-mm.
Oo, mga vasculitis, especially scurvy. Have you considered that?
More on hakoan kami, doc, nakabasehan iya low platelet count.
Oo. But ITP has a low
Yes, doc.
platelet count.
Yes, doc. We also
Oo, especially if
consider
you
that.
have a history of upper respiratory tract prior to and your age pala to nimo patient, ITP is common among 1 to 5 years old, usually
Mm-hmm.
after a viral illness. So, ito nagkakamay diheraan mga nahamo bugyapon na nimo platelet. How about HSP? Di ba HSP can have vasculitis, joint pains, fever,
Yes,
abdominal
doc.
pain. Oo. So, an immunoglobulin iron deficiency anemia, rarely we saw ito ng mga rashes.
Yes, doc.
Or high nutritional type. So, pwede mo dapat vasculitis, scurvy, especially for nutrition, can have mga vasculitis gihap, can have joint pains. Bagagihapon tiya presentation in leukemia. Kasi ang akong CPC dati, scurvy hiya, pero parang aniya presentation was leukemia. And the only difference was an iya diet ang pasyente.
Mm-mm.
Tapos, pero you cannot confirm man talaga not unless mag-bone marrow ka mo.
Yes, doc.
So, siguro you can have put their ITP, di ba ITP, may common
Mm-hmm.
platelet, HSP, you rule it out kasi HSP, normal, usually ito yung platelet count. But, haniya signs and symptoms na PTK, pero ang appearance sa nimo rash laluwat ha HSP was more in the lower extremities and mga low ang mga gravity nga area. But you rule it out because han imo low nga platelet count kasi ang platelet count in HSP is normal. So I think vasculitis ang said. Tapos AML and ALL, mostly kasi at this age, ALL pa ito hiya. Oo. So most common, still your most common leukemia is still ALL in children.
Yes, doc.
Sige.
Doc, question lang about naguluhan kasi na kon doc chief complaint kay an iya reason kay ano hiya nagpakadto karigara doc kay nag-abdominal girth nag-increase. So pero an reason liwat kay ano gin-refer kay low platelet count. So an amon CC po doc, an low platelet count or abdominal girth, increasing abdominal girth.
Actually, akong kunay is kuan nito niya. Amo talaga niya reason for admission? Aw ha karigara?
Karigara. Yes, doc, an na-increase na abdominal girth nga dinahira nagpa kuan
So
consult.
abdominal girth, increase in the abdominal girth ka.
Ah,
Pwede ka actually duhat imo kuan chief complaint so that it imo differentials or in imo working impression would be lessened. Kasi kung salat iyo chief complaint, broad
yes.
masyado kadamot iyo himuon nga differential.
Mm.
At like kunto, at least mas lessen ba, pwede ka magbutang rash and increasing abdominal girth, rash and fever, parang ganun, para mas lessen it iyo differential diagnosis. or pwede gihapon kay actually pinakakunguliet di ba timo rush kay pero na ito ka months tida nga iya rush na wala ka
Yes, Doc.
wawara.
Mm.
So pwede niya pallor, Russian pallor, Russian kuan, amo na nimo chief complaint. Kasi dapat hunahunahon niyo, your chief complaint should be in line with your HPI, your physical examination, so that itimo audience will already know what you are already give you actually ito niya time nga nag-istorya ka mo ito nimo PE nga nan imo history, you're already telling us what are you considering. Kasi kung damot yung magbutang dida, imo audience would have parang difficulty ba? That's why I would be asking you. Mas mo pa kasi inline nga tanan imong history. History, your physical examination, para kami, uy, amo na ini. Maaram na kami kung ano imo kung ano imo gusto ipasabot ha amon. Nga, kasi kami, diri kami to makakakuan hiton imo you might have a wrong diagnosis, but kung it imo history, it imo chief complaint, it imo PE, gusto nimo sugad ito imo diagnosis, kami nga audience would follow ito imo diagnosis. Ha?
Okay po, Doc.
Are there any more question? So this will be our last session. Tapos next week, I don't know kung saan na tiyo bi-monthly exam?
15, Doc.
15 adto, Doc. 15. May 15.
May 15. May 15, wala kasi na kami to dinhi. Sige. I don't know kasi kung bangin adto pa kamot after bi-monthly iton EU exam ha clinics. Dili pa ko sure.
Shifting exam namon, Doc.
Oo. Dili pa ko sure kung niya ang practical or
Written.
written. So I'm just going to ask the consent of the preceptors pa. So we have last na nga kuan.
Yes, Doc. Last presenter.
Okay.
For the growth and development, gross motor, increase awareness of own physical skills and how they appear to others. Fine motor, before admission, the patient is able to dress herself, can eat on her own, and can write and draw random stuff. Well, language, communicating effectively in classroom and playground social settings. For the head's assessment, home from for her home, she interacts well with her siblings and participates in household chores. They have harmonious relationship with each other and there is no physical violence within the family. Education, the child is a grade 5 student at Sanggalan Elementary School. She is behaving in class and has a circle of friends. Her favorite subject is ESP and Filipino, and the least liked subject is math. She interacts well with her classmates and participates in school activities, but she is being bullied. She wanted to be a teacher someday. So from activities, the patient usually plays with her toys and with other children outside. She likes to draw in her notebook when she has free time. Drugs, the patient is not engaged in any illegal drug use and does not drink alcoholic beverages. Sexuality, no history of sexual activity. Suicidality, the patient has no depression, suicidal ideation, nor attempts nor to hurt herself. Safety, she considers their home and community as safe without the presence of any violence at home, no experience of abuse. Spirituality, go to church occasionally but not involved in any church or community services. For the family history, patient father, 42-year-old, a smoker, works a motor driver with a no known medical condition. Mother, 41-year-old, housewife with no known medical condition also. Heredofamilial diseases, diabetes on paternal side, and no other heredofamilial diseases were mentioned. From the siblings, there are no pertinent positives that are found. The patient is the third out of 4 siblings and is currently admitted. For personal and social history, the patient is currently living in Barangay Sanggalang, Biliran in a well-ventilated one-story house made of light materials with 5 other members of the family. They have a dog as a pet at home. Mosquitoes, flies, and rats are seen in the surroundings. Their toilet is a manual flushing type located inside the house. Bilico as their main electrical provider. Garbage is buried on an empty lot far from their house. Their source of portable drinking water is tap water. It is also used for washing dishes, cooking, and taking a bath. They cook inside the house using firewood and feed their leftovers to their pet. The mother is the one who cooks and buys food. The patient usually wakes up around 6 a.m. in the morning and daily and sleeps at 8 p.m. For the risk factors, exposure to cigarette smoke, low socioeconomic status, and household overcrowding. For the physical examination, so patient was examined like conscious, alert, coherent, oriented to time, place, and person, cooperated, nourished, groomed, and well developed. So for the vital signs, there are no pertinent positives that are noted. For the anthropometric data, we noted that the abdominal circumference is 50 centimeters and the ideal value should be 67 centimeters, while the length or the height of the patient is 130 centimeters and the ideal value should be 137 centimeters. For the water classification, we noted no wasting, but noted some stunting, mild stunting, which is equivalent to 94.2% because the normal value is greater than or equal 95%. For the skin, the patient has hypopigmentation located on the right cheek of her face and upper chest area. While the head and eyes, there are no pertinent positives noted. For the ears, nose, mouth, neck, and breast, no pertinent positive noted. For the chest part, there are no pertinent positive noted, while from the abdomen has non-radiating epigastric pain upon deep palpation, scaling 8 to 10. For the extremities, back and spine, there are no pertinent positives noted. And also for the neurological examination, there are no pertinent positives noted.
So for the salient feature under the demographic profile, the patient is 10-year-old female, and under the HPI, the patient has fever, generalized abdominal pain with a pain rate scale of 8/10, headache, poor appetite, tachypnea, watery, diarrhea, and urinary tract infection. And for the review of system, the patient has weight loss, fatigue, headache, dry mouth, change in appetite, and bowel movements, and also has had epigastric pain and leg cramps. Under for the PE findings, the patient has mild stunting and hypopigmentation located at the right cheek, upper face, and upper chest area, and has non-radiating epigastric pain. So for our differential, we consider acute pancreatitis. We ruled it in because of the fever, diarrhea, and epigastric pain. We ruled it out because the patient has no jaundice, no nausea and vomiting, and no alcohol consumption. Another differential is we consider viral gastroenteritis. We ruled it in because of their unreliable water source and sign of dehydration. Uh, Also fever, diarrhea, and abdominal pain. We ruled it out because of there is no vomiting or nausea and chills and sweating and no joint stiffness. We also ruled we also consider shigellosis because of unreliable water source and there is a sign of dehydration and the patient has fever, diarrhea. We ruled it out because the patient has no history of bloody diarrhea, nausea, and vomiting. So for our impression, the patient had typhoid fever. For the basis of fever, diarrhea, abdominal pain, headache, weight loss, and unreliable water source. That's all.
In typhoid, what is the characteristic ito ni fever?
Uh,
Did you see that in your patient?
high grade
Anong
fever.
characteristic fever itong typhoid?
High grade fever, doc.
Ano yung characteristic? Ano pa? High grade, tas ano pa? Step ladder ba to? Or backbone break? Backbone
Step ladder, doc.
ladder, di ba? Did you see that in your patient?
Yes, doc. Kay
How about for the mass? What did you ask about regarding hand mass? Ano mo patient? What happened ko no?
regarding han mas, doc, nagdududa kasi kami kung may kuntod banhiyakan kasi liwat. But
Did you ask? Was there anything done? Did han ka
waray na,
admit?
doc. Waray na, doc.
Waray.
Nagyakan laya may mas daw laya. Yakan daw han, doctor.
Mhm. Pero
Nayakan nga nito, may rectal mass, pero tas may dagap abdominal mass. Yep.
Mhm.
Nagda-doubt kami.
Pero kati mhm. Mhm. Bay nag-typhoid ilitis siya. Oo, typhoid ilitis. Complication na kamahang typhoid kay di ba na ibang ano nagka-typhoid psychosis, nagsi-seizure, nagikukuam, madagyapon
Maray man Doc
ilitis.
kadto nag-present ang patient.
Tapos yung typhoid kasi mainit yung typhoid. Usually, pag more than 7 days na fever, nga high grade, na-consider kita dayon yung typhoid. Kasi buti ba itong sakit nga yung makikita PEDIA, di ba?
Yes, Doc.
Tapos, typhoid. So, have you read about ang typhoid?
Yes, Doc. May
Pero
diya
niya ka
kuan may rash it typhoid pero wala naman nakita ha patient.
kasi itong rose spots, it's at the start of illness. Parang kutel hiya nga blanch located at chest nga area.
Yes, Doc.
And parang madali lahiya mawara. So, ani mo rose spot na appearance. Tapos,
Tapos
ani
medyo
mo
man
third,
na ito man patient namon. Direct lang mga rashes.
siguro ani mo chief complaint, you could have parang iglalasan nimo kasi fever is a very broad damot causes of fever. So siguro ikuan mo fever and abdominal pain,
Oh, yes, Doc.
para
On
malas
amon
na
sa dagat.
naton. So next time kung magkuang ka mo, pwede niyo himuon. At
Anamon
i-achieve
paibot, Doc,
complaint.
untaan fever tapos
Para
abdominal pain.
abdominal pain. Kasi it
Yes.
imo chief complaint, amot usually nga himuon ni mga paibot. Kung
Yes.
bagan wala ka iba or may daka PE nga himon as paibot. So kan ba
Yes.
ito? Have you considered mga amoebic colitis? Amoebic abscess?
Wala namon kuan, Doc. Pero may na kami to kan haamon draft. Pero wala namon
Reference.
Oh, yes, Doc. Wala namon upod ham differential pero na-consider ka man.
Oo, kasi epigastric pain gihapon.
Oh, yes, Doc.
Amoebic colitis, especially if bloody stools, amo laliwag, pwede mo i-roll out. So in amoeba kasi, you have to get the trophozoid. Pero rare lang kasi usually nga nakita kita trophozoid. That's why ito kung na-consider ka na amoeba, you have to do a stool exam 3 times. Tapos you have to imo stool exam, ibubutang mo talaga dihan imo igno-note mo nga check for trophozoid. Kasi kung cyst it can be RBC. Ano yung mga cyst? So pwede to yung shigellosis, gihapon. Kay bloody
Yes,
direct
Doc.
maghihapon ti mo shigellosis.
Yes, Doc.
Kasi nagko-consider di ba nagkumpetahan mass. Kay kung may mass lagi hapon, tapos may fever ka, nagdiarrhea ka, so pwede ka imo amoebic abscess, may abdominal pain ka.
Yes, Doc.
Especially pag nagsiring hiya may mass dito. Ang biliran. Diba? Pwede adto yan. Tapos, and also, siguro amo ito naya kanira nga wala ginihimo because tungod kadamot patient sa VRMC, it tendency doctor or resident would be able to at the same time kasi an education ba they cannot understand tapos at the same time tungod kadamo madali la tapos they often neglect to explain what is happening, what are we doing. Kasi amo ito usually nga naso social media iton i-verms. Oo. Kahit kadamo talaga itong pasyente. Bisan ako, kadamo ako na radyo. Ang resident ko. Oh, because iton kadamo-damo ang imagine ka kami hadto okay nga nito yan na kay damo ran ang resident kami hadto unom la kami. To duty every 3 days. So, to ka mga duty. Senior ka, mga tanan. Ward nga ni kon ang junior ER ka la. So, damo-damuan. So, sometimes, parang na-forget mo ba gihapon to explain relatives, tapos kung magto-toxic na, amo na, sasayupon ka na nga. Sayop ka na. Sasayupon ka na. So, always explain what you are planning. So, amo, dapat, di ba, kung na-admit here, I always ask you kung ano ang siring dito ha, hospital, nga era previous na admit. Kay, kung kita natin itlab explanation itong mga doktor kung ano itong kuan. At the same time, kung itong education gihapon itong imo mga SO, parang kung pwede igwaray mo, igwaray. Kay kung magina ka mga kuan or layman's term ba, kung mag medical term, ang tendency kasi hiton, dire maintindihan. Oo. So, kung mag-explain ka about typhoid, ano naman pag winaray? Si daw Alvin. So, mating ka, typhoid and consideration ni mo, sige, may dako tatong time, typhoid and mo consideration, ako nanay. So, how will you explain to me ito nga sakit? It's well and good to know about English, but when you are in the government setting, you have to practice waray.
Yes. Maya kandok na an kataasan sa hanharanat kung nagbalik-balik ba ang haranat ang pasyente nimo do.
So after na nimo history and PE, ani mo consideration typhoid na, how will you tell me nga typhoid diya?
Ano yun?
Sure. Tapos, you have to ask gihapon. Nakaintindi ka ma'am, may daka ipapakiana pa regarding ini. Pwede ka sumiring dili pa kita nakakayakang budya na pagkaya na nga amo iton aton sakit. Pero basehan at emo simptomas nganan aton pagkita iya, pag-examine ko iya, amo dit sakit ko nga ging ko konsidera. So, di ba imo kuan hito is still what is the drug ang diagnosis sa nimo typhoid, it's still culture.
Yes,
So, kung first week, blood culture. Second week, urine culture. Third week, nga fever stool culture. So, bas ka sa ito niya. So, culture still ito imo definitive diagnosis kasi ito imo typhoid. Kasi ang serologic, parang di rin manggod ito niya definitive in diagnosis. So, pwede magyakang ka. At the same time, you have to ask, naintindihan mo ma'am. Tapos pag next day, ma'am, nag-start kita ng antibiotic, yung kita natin. So always explain. Kasi ito iba, pagkakatulid to, after pag-order, lakat na, waray na. So, ani mo pasyente, ani mo kag-anak, may tumasig therapy, di ba, nagyakan nga, waray ginihimo, which is very wrong. Kaya pag sulod mo pala emergency room, damo nang ginihimo. Majigat ka mo naman nga dugo, examinations, itong CBC pala, nadextrosan ka. So ito pala, may nanagin himo-imo. Kaso la, wari ka makikita. Oo. Oo. So, pwede ka magpakiana nga. Kaya no, wariya pa kauna. So, ina-explain kita nga pwede may bangin nagko-consider nga may buho, tinai, di ba? Kaya bagay na amay to natin consider yan na typhoid, ilitis. So pwede kasi kung magkaon niya, makaka mas grabe lugo dito niya sakit. Oo. Oo. So gad ba ito? Tapos siguro kulang line explanation which is happening especially in the government setting because parang damo-damo talaga timong pasyente dito. Actually, ito imo home against medical advice, it's still a patient's right. But you still have to exhaust itong explanation. Kay most of the time, oo, masing ka to ma'am, diri gad kay pag-ulpot pala niyo. Na-dextrosan na hiya, nag-antibiotic na nga ni kita iya. Asya, siguro kailangan lang explanation. Tapos kung mag go against medical advice, patient's right kasi iton. Dili mo pwede liwat herapugngan. And akon lahat to tendency no nalabinahan EVRM sen di na pa man ako nag-resident handaan ba. May dako malnourished nga kuan. Ginhulat ko talaga nga dito kami ER. Dito ka ER ginpatanggalan ng dextrose bago ko matuhan sa sakyan. Kasi anything that will happen nga ada pa hiya hospital nga kuan liable ka pa, di ba? Kay di ko man tuyag yung papa-discharge pero gusto kasi kag anak. So, kung sa ganito, pwede ka pa mag-explain laanay. Pero kung di rigod talaga, papapermahon mo. Yan nag-decide. Tapos yan na kasi, kung ipapaperma mo against home medical advice, ipapabutang mo ang reason kaya anong gusto umuli. Pero at least ba, kuan anay, explain to the parents well. Kasi most of the time, they don't understand. May ako to one time diaphragmatic hernia, anak kada nito dito FRMC. Waray good gusto ni Raig Kuli ang bata, which is very wrong. Ito kay pwede man him operahan. So eventually, naiha kami nga discussion, haros ko pa ng pathophysiology and diaphragmatic hernia. Pero eventually, na-convince ko ba yung pagpa-opera kay newborn baby. Diba, diaphragmatic hernia, waray man hiras kan, ang congenital scan. So, newborn pala. So, nadirira pagpa-opera. Pero eventually, nagsige hira. Tapos, nakauli hira. So, kailangan lang, explanation lang niyo. Hmm? Yeah, even if you are busy, give time to your parents. Show rapport, show empathy. Kasi most of the time, parang waray-waray good. Yung Pilipinas, makorean at panahon. So most of the time, labi na emergency, you will be dealing with patients na they're educated, they don't know, may dapayan na kita mga they don't know how to read and write. So you have to explain lang. Hmm? So good luck. Siguro pag kita ko you next time, you will be future doctors na. I hope you will consider also PEDIA. Oh, di ba? Pediatrics. Oo. So, para, oo, kita, mga bata pa at mga PEDIA. I'm already 42 years old. Oo. Lagas na. Lagas na. Oh, so, hopefully you will consider PEDIA also. Tapos UB subspecialty. In pediatrics, there's 3 years. Para kung anong kula ka mo ha. 3 years ito niya. Tapos you have to take the exam. After that, hopefully ka mo mga bata pa ka mo, pag subspect ka mo dayon. Kaya we are missing subspecialties here in Region 8, which is badly needed it aton mga pasyente.
Anong kailangan Dok ng mas
I'll give the floor ha iyo nga mga
specialty?
young generations. Ano?
Ano mga kulang
Wow,
na
kulang talaga.
specialty ko nun, Dok?
So far, ano ba't kulang yan na? Genetics. Pero kahit tag-usa-usa la kasi yan at yung mga suspect. DepEd o sala. Tox, ni Dr. Augusto o sala. Infectious, maduha na to nira o tulo. Nephro o sala. O rheuma o sala. Tag-usa-usa la kasi ito nira. Pinakadamo is pulmo. So hopefully mag-consider ka po pag subspecialty, especially ka mga young pa. Okay? Tapos you can serve in people in the region 8. O, di ba? O. So I'll give the kuan to you, the young generation. Sige. Are there any more question? Next week, diri pa ko sure. Maya ka na lang ako, Alvin, ha? Bangin, mag-send na lang ako niyo, please.
Yes, Doc.
Okay lang, Dok.
Good luck, hindi you by monthly sum. Wow! Mapa Manila kasi ako. Busy akong duro, char. Akong clinic. Hirayo ako. Adya sa Tolosa.
Para nila, Dok. Oo.
Magro-road trip ka mo. Makurit akong kuan. Kaya adya ka Tolosa, adya ka Merkado. Makarao dahil iyo. Ako nagdalaga. Actually, kuan ako, Monday to Thursday, okay gala ako. Pero kay pag Saturday, pan Manila na ako next week. So, mabalik ako pa. Oo. Ikaw mo la, kung saan niyo gusto. Char.
Sige, Doc.
Libre ko ka mo ba? Libre. Social. Ay, naniguro. We can have coffee. Oo, kung gusto niyo, next week. Next week na lang. Kung saan ulit available nga time. Ha?
Sige, Doc.
Oo, sige. Ano? Ano, pira ka mo? Damo na. Wala ko naglilip.
9 kami,
Sige,
Doc.
balitaw. Okay lang. Okay lang. Sige, see you na lang.
Doc,
Sige,
attendance.
Doc. Thank you.
Okay.
Ano,
Okay.
paano pag gallery out? 1, 2, 3, smile. Open cams. Misa.
Okay, sunod pagkita ko ayo, di nangingilalat yung mga face.
1,
Kay
2, 3, go.
mga professionals. Yan, wala pa ka mga buot. Pag kuha ni resident.
Thank you, Doc.
Okay, sige. Alvin, nag-text na lang kung saan ka mo available, ha? Okay man lang
Sige,
ko yan
Doc. Sige, Doc.
next week.
Yan na nga, next week. Okay, Doc.
Oo. Okay.
Thank you, Doc.
Bye,
Thank you,
Doc.
Doc.
Bye.
Thank you.
Thank you, Doc.
Maray na.
Pare na lumakat na.
Ginawa
Preston.
ba, pre? Inaaway ka.
Pare na nim, thank you.
May matatap lang doon nga, Kevin.
Paano magpa-quiz si Doc? Ano?
Hello.
Sige, sana kita maka-schedule pa. Nagpabutan ni Doc yan.
Hi, Nina. Hi, Nina. Hi, Nina.
Wala rin nagpatulos sa yan.
Good mood dito ko.
Nakatori na isa.
Yeah, it lang.
Wala klase, di ba? Surgery.
May dari. Pero may rehab med.
Rehab med lang.
Rehab med na dahil. Face to face.
Okay. Dilak mga sulod.
Wala ka lagot nag-duty.
Buwas
Duty
pa.
ka?
Buwas pa.
Sayang, wala ka lagot nag-duty.
Friday, Saturday.
Saturday, wala
Nag-duty
kita
nga
mga
to.
exam.
Waray. Waray klase online nga nila. Ambutit auto, ambut. Anedok. Stranded lagi pa da.
Ikaw na, urusan na lang ito kay TP man lang ito.
Char.
Kaya netit masamsam.
Sana niya duty ni Doc? Monday to Wednesday? Ako diyan naka-record. Sige, sige, taada.